GP works essentially in the community, treating patients with both long-term and short-term medical problems. We see them in the GP practice as well as in their own homes. We see patients who walk in the surgery asking about anything from a stuffy nose to long-term problems like diabetes, chest pain. We don't know what's walking through the door next, but we have to be prepared to handle any of it. I've always wanted to be a general practitioner. I like people. I love talking to people, finding out what's wrong. And I did research first, and I remember a professor said to me once, why would you want to do medicine where you're only helping one person at a time as opposed to hundreds of thousands with research? But for me, it's that one person that makes a difference. The first step of becoming a doctor is looking at what medical school, what university offers the med school that you want to be at. But I think the first question you need to ask yourself is, do I really want to be a doctor? Do you know what it involves? Do you know the hours it involves, the actual job that it involves? So I'd really recommend going out and having some work experience, and whether that's at your local hospital, nursing or care home. There's a lot of options, so it's worthwhile seeing what's local to you. To become a GP, everyone has to go through medical school. You graduate from medical school, and everyone who wants to practice as any type of doctor does 2 years of foundation training, and that's where you rotate through different jobs at hospitals. After those 2 years, you pick your specialty. In general practice, although in the title it says general, it is a specialty of its own, and you apply for that, and it's 3 further years of training where you rotate through different specialties, including general practice and working and seeing patients in a surgery setting. There's so many different tools we use as GPs. Probably the most important tool is listening. Obviously, we need our medical knowledge in order to come to some conclusions and diagnosis. I don't think we can just look at someone and decide. We have to examine them, and so we have our tools like stethoscopes and devices for looking in ears and eyes. And it's about using all of those things that helps us become doctors and helps us actually function and work well as doctors. In medicine in general, it's so important to look at the whole person and not just what they're coming in with the presenting complaint of. You need to understand a bit about their background, where they're coming from, what they understand, as well as their medical problem that they're coming in with. I don't think you could be a doctor or do a profession that's very emotionally and mentally involving without having a really good work-life balance. And so I have a great life outside of work. I have a really good social life, a great group of friends, and I don't think you could handle this job without having that. I absolutely love my job. I enjoy coming into work every morning, not knowing what's going to come in. I like seeing patients that I'd seen a couple months before, following up on their progress. I love the fact that GP is a wonderful mix of science and art. The science is the medicine, the challenge of thinking through problems, but the art of GP is communicating with people, finding out what's wrong, and actually getting to the core of the problem. I think that often gets missed in other areas of medicine. So, if I was going to give anyone advice about becoming a GP, I'd give them the advice of get some work experience in the area, find out what it's like to be a doctor, study some biology at A levels, because that will give you a step up when you start university. If you don't love people, I would say GP isn't the line of work for you, but it doesn't mean that you can't do other jobs in the medical arena. You really have to be prepared to work hard. But if you're prepared to work hard, the rewards are phenomenal.